Welcome to this session. In today's session, we are going to concentrate on PID, which is pelvic inflammatory disease. This is an essay which came in Nmcz 2022 as an essay question. So I'm going to explain what this condition is, and we're going to answer a couple of questions pertaining to this PID, and that's how we are going to discuss it that way. So let's get started. This is the question. So the question, as I said, was derived from Nmcz 2022, and it reads: Miss Beth Apiri has come to your gynecology clinic with a history of lower abdominal pains and foul vaginal discharge for 2 weeks now. On examination, a diagnosis of pelvic inflammatory disease is made. Okay, so that was the question, and then that was the scenario, and then question A is saying define pelvic inflammatory disease. So you need to define it to make sure that you earn the 5 marks. And how are you going to define it to make sure that you earn the 5 marks? Okay, so you are going to define pelvic inflammatory disease in this way. So you say that pelvic inflammatory disease, this is an infection and inflammation of the female upper genital tract. Okay, these female upper genital tracts include the uterus, the fallopian tube, ovaries, and the surrounding pelvic structures, caused by a microorganism, most commonly sexually transmitted infections such as the chlamydia trachomatis and the Neisseria gonorrhoeae. These are the microorganisms, okay, characterized by vaginal discharge, like the one which has been mentioned on top there, causing tissue damage, and or maybe if not treated early, it can actually cause some long-term reproductive complications. By this definition, you have described and you've added some signs and symptoms. You've also added the cause, and you've actually given the prognosis of a disease, that if at all there is no prompt treatment, the woman might experience some long-term reproductive complications. And that's the definition of what pelvic inflammatory disease. Now we want to go to outline 5 risk factors to PID. Now when you look at this question, it's saying outline 5 risk factors to PID. So you are not just going to list them. You need to at least explain how these risk factors are going to cause PID. So most of the time, that's why you lose marks when you just, where you're supposed to state, where you're supposed to explain, you just list the product or the answers rather. So you need to explain a little bit how these risk factors are going to actually bring about PID. So what are some of the 5 risk factors that are associated with the PID? Okay, so number 1, we have, of course, the most obvious one, the multiple sexual partners. Okay, so how does multiple sexual partners cause PID? So definitely we know that having more than one sexual partners, it increases the exposure to partners' different flora. We are talking about these infections that we described, the ones I mentioned in the definition, the chlamydia trachomatis and the Neisseria gonorrhoeae. So as you engage yourself with different sexual partners, it actually raises the probability of someone acquiring the STIs, the same ones which I've mentioned. Okay, and these same ones are the ones which are the leading cause, or I would rather say the agent for PID. So that was point number 1. How about point number 2? So the other point is that through having unprotected sexual intercourse. So how does unprotected sexual intercourse causes PID? Okay. So now, the fact that these measures or contraceptive measures like the barrier protection in case of using a condom, that barrier protection actually reduces the chances of someone to directly expose themselves to STIs. Okay. In other words, it reduces these barrier like condoms. They will reduce the bacterial transmission. Okay. So meaning that if you are having unprotected sex, most likely that you are exposing yourself to a lot of these. You are exposing yourself so much to these causative agents that we described. Okay, so that is the point on having the protected sex. Then the other point on the risk factor, we can also have the previous history of STIs or the PID. Okay, so those women who have had the chlamydia or gonorrhea, or maybe the previous PID, they have actually damaged the cervical, or the worst is the tubal epithelium. So since they have damaged the cervical or tubal epithelium, this makes it easier for infections to actually ascend, then increasing the susceptibility of this woman for reinfection. Meaning that those who have had it previously, they can be reinfected. So that's one of the risk factors for PID. And then the other risk factor for PID is based on sexual behavior. So early onset of sexual activity. Okay, engaging in sexual activity at an early age. Okay, so now how does this come about? We must know that adolescents have a more immature cervix, and they actually the columnar epithelium is exposed in the young ones. So this makes it easier for organisms such as chlamydia or the Neisseria gonorrhoeae to actually invade. So this increases the risk of ascending infection. Then they go upwards, affecting the pelvic. Okay. So that was on sexual behaviors, engaging. I mean, early inset of sexual activity. Okay. And the other risk factor is the use of intrauterine devices with some existing STI. Okay. So of course the intrauterine devices, they are safe. Okay. However, the problem comes in when you are inserting the intrauterine devices when the woman already has an untreated cervical infection. You want to insert these intrauterine devices when a woman is already having an existing cervical infection, which will actually push these bacteria into the upper genital tract. So you get that's how it is. Okay. So since you have pushed those bacteria into the upper genital tract, you find that you are actually increasing the risk of what? Of the PID. Okay. So those are 5 risk factors to PID. And I was actually outlining them, not just listing them. Okay. Now I want to look at B, question B, Roman numeral letter 2. So what is there on the how can you know that someone is having PID. So those are 5 signs and symptoms of PID. So once you actually stating meaning you need to give a little bit of information. So out of these 5, one is carrying 3 marks. So you need to earn 3 marks on one sign or symptom. So what are signs and symptoms of the PID? So we have lower abdominal pelvic pain. Okay, so the lower abdominal pelvic pain is the most common symptom. Okay, so why is there a lower abdominal pain? So the lower abdominal pain comes due to the inflammation of the pelvic organs will actually cause irritations, and this irritation and since you know the inflammation process, so inflammation will cause irritation and the stretching of the tissues. Okay, so due to that irritation and the stretching of the tissue, it will lead to continuous pain. Okay, then the other point, the other sign and symptom is foul smelling vaginal discharge. Okay, foul smelling vaginal discharge. You know there is an inflammation in an inflammatory process that is going on. Okay, so now how the inflammation leads to the vaginal discharge, which is foul smell. So you find that where there's an inflammation, this inflammation will actually they actually what we call morphology of inflammation. So inflammation releases some discharges depending at what level of a contamination of that particular it could be a wound or an area. So we have the serous, we have the catarrh, we have the prurient. So now in pelvic inflammatory, inflammation causes mucoprurient discharge from the cervix as well as the vagina. Okay, because at this point the body is responding to infection. And then now the problem, what causes the offensive smell is the anaerobic bacteria that are there, that are present there. They are the ones which are going to actually contribute to the offensive smell. And then the other sign and symptom we have is fever and chills. So fever and chills, this just comes due to systemic spread of the infection. Okay, which triggers an immune response, and this resulted in elevated body temperature. Remember, an immune response that is going to come due to the inflammatory process. So when the leukocytes come at the infected area, they are what we call cardinal signs of inflammation. On cardinal signs of inflammation, you find that there is pain, dolor. So temperature, increased temperature is actually one of the signs of inflammation. Okay, so that's why this person is going to have fever and chills. And the other sign and symptom is actually pain during sexual intercourse. Okay, so how is pain going to occur during sexual intercourse? So this is just a normal reaction, because of course the inflammation of the uterus and some of the tubes, they actually make deep penetration. So they're like these same the inflammatory process it's going to make some deep penetration. Okay. There are going to be this deep penetration. Remember, it's going to be actually painful as the inflamed tissues are what? They are being compressed. Okay. So that's pain during sexual intercourse. And then the other sign and symptom is the intermenstrual bleeding. Okay. Intermenstrual bleeding. How does the intermenstrual bleeding comes about? So the intermenstrual bleeding comes about due to the inflammation of the endometrium, also known as the endometritis, which disrupts the normal menstrual pattern, leading to intermenstrual bleeding, which we call bleeding between periods. Okay. So those are signs and symptoms of PID. Now question C is saying, outline the management of Miss Piri. How are you going to manage Miss Piri? How are you going to manage Miss Piri? So here you need to explain a lot of things for you to actually earn the 50%. You need to explain a number of things for you to earn the 50%. So when you're actually starting the management, you need to actually start with the aim. What is the aim of the management? Of course, you want to prevent complications. You also want to reduce pain. Okay. And at the end of the day, you want to preserve life. So whatever that you are going to do under the management of Miss P, everything is going to be thoroughly correlating to your aim. Okay. So some of the points that you can put under the management of Miss P is one of it is the assessment. Okay. Nursing assessment. So what is involved in assessment? Of course, as a nurse, you are going to take comprehensive history about the onset, nature of the abdominal pain, vaginal discharge characteristics, the menstrual history, the sexual history, contraceptive use, okay, the previous STIs that the patient was suffering from. You're also going to perform vital signs. Okay, in case where I remember when we talk about the signs and symptoms, we described about fever, the fever which comes about due to the immune system trying to react to what is happening. Okay, so you need to do perform the vital signs. Okay, you can also do the abdominal palpation for tenderness. Okay, so all this on assessment, you just want to collect the baseline data where you're actually it's going to guide your care planning and actually identify some kind of complications, any complication that can arise. So assessment is very much important so that you are going to assess Miss P. I'm just going to give hints here on how to go about the management. I'm not going to explain the entire management, but this is how you go about it. And then you can also do the pain management. Pain management, since you are a nurse, you are going to assist Mr. P with pain management the non-pharmacological way. Okay? So you're actually going to assess Miss P for severity of pain. You want to actually assess how much pain is Miss P experiencing using the pain scale. Okay? And then you are now going to provide some non-pharmacological techniques. Okay? that are going to actually elevate this pain, like the warm compresses to the lower abdomen, okay, or even the positioning, okay. Proper positioning also promotes patient comfort, okay. And apart from that, on positioning, I can also add on the point of let's say you put the woman, since she's having some vaginal discharge, you can actually put the woman in a semi-fowler position. This will actually promote pelvic drainage. Remember, this whatever discharge is infected. So if at all it can get removed, then you are actually intervening in a best way. Okay. You actually also can train your patient to actually do some deep breathing exercise, some relaxation techniques, and whatever that they can find. Okay. So you also continue monitoring the patient. Okay. This is just to make sure that they are comfortable. And actually, when you actually spend more time with the patient, you're actually improving cooperation with them, with the treatment. They will listen to your advice, just like that. And then apart from that, the other point that you can include in the management could be, even rest and sleep is very much important in the management of the patient. So you need to create an environment that is going to promote rest and reduce on physical strain, because the patient need to heal. Okay, so you need to encourage the patient to actually, you need to encourage Miss P to actually rest, so that in resting, it's also going to reduce discomfort, it's going to support healing, and it's also going to conserve some energy, rather not reserve, conserve some energy. Okay. Then the other point you can include in the management is infection control and prevention of the spread. So how are you going to do the infection control? Infection control, you as a nurse, you are going to educate Miss P on the hand hygiene. Okay. You also educate them on the perineal care, wiping from front to back, all these hygiene standards. Okay. And the proper cleansing during the menstruation, you're actually going to help them. So all these things are tailored at preventing infection. Okay. These things are tailored at preventing infection. And also tell Miss P to ensure that the dressings are safely disposed, okay, to prevent cross infection. Remember, also caring about other patients in the ward. You're not just looking at Miss P. So to prevent cross infection, make sure that she disposes those used pads or dressings safely. Okay. So yeah. So all these things will also prevent the ascending infection and reduce contamination risks. Then apart from that, you can also go on, of course, I'm just trying to give you a hint on the management. You can actually explain a lot of things for you to end the full 50 marks. Okay. So you can also include the point of administering and monitoring antibiotic therapy. Of course, this is a prescribed med. Definitely they are on infection, so they will need to be on what? On antibiotic. So you as a nurse, you are going to make sure that the drug is administered at the time that is supposed to be taken. Okay, you fulfill the nurse duty, and you make sure that you also monitor for the adverse reactions of a drug, and also look at the effectiveness of the treatment you need, if the patient is responding or not. Okay, so in case of any allergic reaction, you actually report it. Then apart from that, in your management, you can also include health education. So health education Health education is just, you are just going to give IEC on various things related to this condition. So you can give IEC on the medication that they are taking, on the sanitation, hygiene, okay. Let's say avoiding, I mean the importance of abstaining from sex during this period, okay, and actually explain the importance of completing the entire course, okay. And then you should also indicate the partner notification and counseling. So you also need to let the partner know of this condition, okay, and tell them also about the importance of abstaining from sex, because they might just making things worse, okay. And then you can also do the psychosocial support and emotional counseling, because this is a difficult moment for them. So you just need to like some patient can feel guilty, they can have anxiety or fear of not bearing children in future. So you just need to explain to them that just be there for them, empathize with them, to say that if at all you adhere to the treatment, everything will be fine, okay. That will also lead to adherence. And then the other point you can include is in the monitoring, follow-up care, as well as evaluation of care. So at this point, you just want to actually you want to check the progress of the care that is being given to them, okay. So you can actually schedule a follow-up care within 3 days to evaluate symptom improvement. You also check vitals, you also assess for ongoing pain, observe changes in the vaginal discharge, because the volume as well as the smell can tell you something about it, okay. You also evaluate on the adherence of medication, yes, and other things, etc. So you explain on those ones and make sure that you give information for you to earn the 50 marks. For now, let's go to D, which is saying explain 4 long-term effects of PID. 4 long-term effects of PID. So long-term effects of PID we are looking at, these are just, in other ways we can refer to them as the complications. So what are some of the complications of the pelvic inflammatory disease? Of course, one, we have infertility. How does infertility come about? So you want 4, meaning you need 4 marks for each point, then you earn 20. So I've said infertility. I don't know if you are going to be given 1 mark, then your explanation get 3 marks probably. So now how is infertility comes about? Okay. So you know that in PID there is inflammation. So this inflammation causes the scarring and blockage of the fallopian tube. Okay. This type of inflammation probably could be the chronic inflammation. Okay. So what happens if the fallopian tube gets to be blocked? Meaning that even if you meet with a man, sperm is not going to reach the egg, because this has disrupted the ovum transport. Definitely, if the sperm cannot meet with the egg, then that will lead to infertility. Then the other long-term effect could be ectopic pregnancy. Ectopic pregnancy. How about ectopic pregnancy? Okay. So now, look at this pelvic inflammatory disease. It occurs, there is an inflammation, and then there is damaging of these, the pelvic organs. You understand? Okay? So when the same, particularly the tubes are partially damaged, but they are not completely blocked, what happens is that the fertilized egg may implant within the tube rather than the uterus. if there is just a partially damaged, they are partially damaged and not completely broke. So the egg might implant within this tube and not the uterus. You get it? So now, because this tube, let's look at the fallopian tube, maybe it's severe, it's partially damaged, meaning that it's unable to move the embryo. And if at all the baby continues developing within the fallopian tube, that can cause actually the rupture of those membranes, and it can actually eventually lead to maternal death. Apart from that, we can also talk about the chronic pelvic pain. How about the chronic pelvic pain? So the chronic pelvic pain will actually come just like the way we are evaluating the signs and symptoms when we are describing pain. Okay, so pain was coming due to kind of what? Inflammation. So this inflammation, the inflammation will lead to some of the pelvic organs, specifically the tube, to adhere to each other. Okay, once they adhere to each other, meaning that they are in an abnormal positions. So this causes persistent pain, which can even last for months and years. Okay, so just like in the signs and symptoms we described about pain during sexual intercourse, because these two parts have adhered and it's abnormality to this particular organ, so they might actually this pain might worsen during menstruation or sexual intercourse. Okay, and then the last one we can have as a long-term effect, it could be the same PID. It can be happening, okay, from time to time. It can be recurring. So this recurrence usually occurs due to scarring of, the scarring of the fallopian tubes. So this scarring, this scarring will actually weaken the fallopian tubes and the cervix. Once they become weak, so the reinfection is more likely. And for as long as the infection comes back, it comes back with a severe effect and has a great risk of infertility. So that's all about this paper. I hope you enjoyed it.